Hey, welcome to Following Science, where we dive deep into topics that matter for your health and well being. I'm your host, Rutu Ruparel, and today we're going to be tackling a crucial topic in healthcare: Medicaid versus Medicare. Understanding these programs and the differences within them is essential for making informed decisions about your health coverage. So, let's break it down. Let's start with Medicaid. What exactly is it? Well, Medicaid is a government program that provides health coverage to millions of low-income individuals and families in the United States. It's designed to help those who may not be able to afford healthcare on their own. But eligibility isn't just about income. It also includes specific categories such as pregnant women, children, and people with disabilities. Now, Medicaid serves as a safety net, ensuring that vulnerable populations have access to essential medical services. Unlike Medicare, which primarily serves seniors, Medicaid covers a broader demographic, including children and adults under specific income thresholds. Now, to qualify for Medicaid, individuals and families must meet income guidelines set by their state. Eligibility criteria can vary, but generally it's based on household income relative to federal poverty level. States also consider categorical eligibility, meaning specific groups automatically qualify based on factors like age, disability status, or pregnancy. Now, Medicaid offers comprehensive coverage, including doctor visits, hospital stays, and prescription drugs, and of course, preventive care. It also supports long-term care services for eligible individuals who require assistance with daily activities. One unique aspect of Medicaid is its joint federal-state funding and administration. While the federal government sets guidelines and provides funding, each state manages its Medicaid program, tailoring it to meet local needs. This flexibility allows states to expand coverage options and services based on their population's health priorities. Now let's turn our attention to Medicare. Unlike Medicaid, which is means-tested and primarily serves low-income individuals, Medicare is a federal health insurance program primarily for seniors aged 65 and older. It also covers certain younger individuals with disabilities or end-stage renal disease. Medicare aims to provide essential health coverage to older adults who have contributed to the Social Security system through overall payroll taxes during their working years. It ensures that seniors have access to necessary medical services and treatments as they age. Now, to qualify for Medicare, individuals must be typically 65 years and older. Younger individuals can also qualify if they have certain disabilities or permanent kidney failure requiring dialysis or a transplant. Now, Medicare coverage is divided into several parts, starting with Part A, hospital insurance, which covers inpatient hospital stays, skilled nursing facility care, hospice care, and some home health care. Then there's Part B, medical insurance, which covers outpatient care, doctor visits, preventive services, and medical supplies. Then there's Part C, Medicare Advantage, which offers an alternative to Part A and Part B through private health plans that often include additional benefits like dental and vision care. And lastly, there's Part D, which is prescription drug coverage, which provides prescription drug coverage through private insurance plans approved by Medicare. Now, one key distinction within Medicare is the choice between Original Medicare, Parts A and B, and Medicare Advantage, which is Part C. Original Medicare is the traditional fee-for-service program managed by the federal government, while Medicare Advantage are provided by private insurance approved by Medicare. These plans often provide additional benefits, but may have different costs and coverage limitations. Now that we've covered the basics of Medicaid and Medicare individually, let's compare and contrast these two vital healthcare programs. Medicaid primarily serves low-income individuals and families, including children and adults who meet specific eligibility criteria, where in contrast, Medicare focuses on seniors aged 65 and older, along with younger individuals with disabilities or certain medical conditions. Medicaid also operates on a federal-state partnership with funding shared between the federal government and individual states, and states, of course, have the flexibility in designing and implementing their Medicaid programs, which can lead to variation in eligibility, benefits, and coverage options across the country. Whereas, in contrast, Medicare is funded and administered solely by the federal government through the Centers for Medicare and Medicaid Services, or CMS. Now, Medicaid also offers comprehensive coverage that includes a wide range of medical services, from primary care to specialized treatments and long-term care. This comprehensive approach aims to meet the diverse health needs of low-income populations. In contrast, Medicare provides specific benefits outlined in the various parts that I mentioned before, A, B, C, and D, focusing on essential healthcare services tailored to the needs of seniors and individuals with disabilities. Now, both Medicaid and Medicare can coordinate with other healthcare coverage options, such as employer-sponsored insurance or supplemental insurance plans like Medigap. Coordination ensures that beneficiaries receive comprehensive health coverage and support, minimizing out-of-pocket costs and, of course, improving access to needed services. Now, despite their importance, Medicaid and Medicare can be complex to navigate, leading to common misconceptions and challenges for beneficiaries. One common misconception is that Medicare covers all healthcare costs for seniors, which isn't entirely accurate. While Medicare provides substantial coverage, beneficiaries may still face out-of-pocket costs, especially for certain services or medications not fully covered by their plan. Similarly, misconceptions about Medicaid often revolve around eligibility requirements and the scope of the services available, leading some individuals to underestimate their potential eligibility or benefits. Now, accessing Medicaid and Medicare services can present challenges, particularly for individuals unfamiliar with the application process or program requirements. Navigating enrollment, understanding coverage options, and managing changes in healthcare policies can be daunting for beneficiaries and their families. Now, changes in healthcare policy, such as legislative reforms or funding adjustments, can significantly impact Medicaid and Medicare recipients. Policy changes may affect eligibility criteria, benefit structures, or coverage options, influencing how individuals access and utilize healthcare services under these programs. Now, that's going to be it for today's episode. I know it was a short one, but it was a very important one as well. Now, as I wrap up today's episode, we've covered a lot of ground discussing Medicaid and Medicare. And of course, as I mentioned before, these programs play critical roles in ensuring access to healthcare for millions of Americans. But understanding their differences and complexities is key to making informed decisions about your health coverage. Now, to recap, Medicaid serves low-income individuals and families through a federal-state partnership, offering comprehensive coverage tailored to specific eligibility criteria. In contrast, Medicare provides health insurance primarily for seniors aged 65 or older, along with younger individuals with disability through federal funding and administration. Now, whether you're navigating Medicaid, Medicare, or both, being informed about your options and rights empower you to advocate for your healthcare needs effectively. Remember, each state may have unique Medicaid programs, and Medicare offers various coverage plans, Parts A, B, C, and D, to meet diverse healthcare needs. Now, as I wrap up today's episode, I just want to thank you all for tuning in today. I encourage you to explore other resources provided by your state's Medicaid program or visit Medicare.gov for more information about Medicare coverage and enrollment. And of course, make sure to stay tuned for our next episode when I post it tomorrow. That's it for now. If you enjoyed this episode, please subscribe, rate, and leave a review. Your feedback helps us bring you more valuable content. Until next time, take care and stay informed about your health. This is your host, Rutu Ruparel, signing off.